Hello. These days at Rajshree Medical Research Institute, Bareilly, pre-university exams are being conducted, and on 3rd of December, there was this anatomy paper 2 exam, and in this there were 20 MCQs. So I've uploaded these MCQs for you all, so you can check your answers. Question number 1 was, bronchopulmonary segments are well-defined sectors of the lungs, each of which is aerated by a separate secondary bronchus, tertiary bronchus, terminal bronchiole or respiratory bronchiole. So the answer will be tertiary bronchus. Okay. Then question was, internal thoracic vein drains into subclavian vein, brachiocephalic vein, internal jugular vein or external jugular vein. So the answer will be brachiocephalic veins. Okay. The next question was, which of the following structure is not seen in a transverse cut section of thorax passing through the 4th thoracic vertebrae? Right? It's 4th thoracic vertebrae, remember this. Now the choices are arch of aorta, left principal bronchus, left recurrent laryngeal nerve, superficial cardiac plexus. So out of these, which is not seen in the transverse cut section at 4th thoracic vertebrae? So the answer will be left principal bronchus. Remember, it is 4th thoracic and the manubrio-sternal angle lies at the level of T4, T5, right? So, and at this level there was bifurcation of trachea, the carina. So left principal bronchus will lie below to this level. Rest all of them are content of superior mediastinum. Okay. Which of the following statement is a wrong statement regarding the superior vena cava? It begins behind the lower border of the first costal cartilage. It pierces the pericardium behind the second right costal cartilage. It terminates into the right atrium behind the third right costal cartilage. It is 10 centimeter length and has no walls, which is the wrong statement about SVC. So remember, all of them are correctly mentioned except the length. So the length is not so much. The SVC, the length is around 7 centimeters, right? Okay. Skin of posterior 2/3 of the scrotum or labium majus is supplied by ilioinguinal nerve, genital branch of genitofemoral nerve, femoral branch of genitofemoral nerve or posterior cutaneous nerve of thigh. So in this, actually the main nerve supply they have not mentioned, and that was a posterior cutaneous nerve of the scrotum or posterior scrotal nerves, right? That's in the median posterior 2/3 of the scrotum medially, but laterally in the posterior 2/3 of the scrotum, the nerve supply is by posterior cutaneous nerve thigh. These are the perineal branches from this nerve given, supplying the genitalia and the posterior 2/3 laterally. Okay. Then root of the penis is innervated by dorsal nerve of penis, ilioinguinal nerve and genital branch of genitofemoral nerve, perineal branch of posterior cutaneous nerve of thigh, posterior scrotal nerves, right? So root of the penis actually is lies actually in the anterior 1/3 of the genitalia, right? And the nerve supply by anterior genitalia is by ilioinguinal nerve and genital branch of genitofemoral nerve. And remember that dorsal nerve of penis actually innervates the skin of the anterior portion, the shaft of the penis as well as the glans. Okay, so this is the right statement. Okay. Which of the following is a wrong statement regarding arteries and their immediate source? Look here now. Artery to chemaster arises from the inferior epigastric artery. Is this correct? Deep circumflex iliac artery arises from femoral artery. Check this out. If it's correct, superior suprarenal artery is a branch of inferior phrenic artery. Inferior rectal artery is a branch of internal pudendal artery. So, what is the wrong combination? Which of the following is the wrong statement regarding arteries and their immediate source? The answer, remember, is that the deep circumflex iliac artery is a branch of external iliac artery. Okay. And superficial circumflex iliac is a branch from femoral artery. Next question is, lymphatics from the anal canal part below the pectinate line drains into internal iliac nodes, pararectal nodes, deep inguinal lymph nodes, medial group of superficial inguinal lymph nodes. So, remember that pectinate line actually is like a watershed line. So, the area below to this in the anal canal drains into the medial group of superficial inguinal lymph nodes, and the area above the pectinate line drains along with the rectal lymph vessels into the internal iliac lymph nodes. Okay. Now, which statement is false regarding the gastrointestinal tract? Listen carefully. That which is the wrong statement about GIT? You have to find it out. Throughout the length of the small intestine, the diameter of the lumen keeps decreasing from proximal to distal. Is this correct? Throughout the length of the small intestine, the length and density of the villi keeps decreasing from proximal to distal. Throughout the length of the large intestine, the diameter of the lumen keeps increasing from proximal to distal. Throughout the length of the intestine, the number of goblet cells in the lining mucosae keeps increasing from proximal to distal. So, which is the wrong statement in this regarding GIT? So, remember that yes, from duodenum jejunum ileum, the diameter keeps decreasing, right? So, small intestine, the minimal diameter is at the ileocecal junction. So, that's correct. Throughout the length of the small intestinal density of villi, of course, this one is also correct. So, remember that your answer actually will be this here. So, remember that cecum, you must have heard, like cecum is the proximal portion of the large intestine and it is more wider than its length. Its length is less and its breadth is more, right, in GI. So, that's the largest and the most dilated portion of the large intestine, cecum. And from there proximal to distal, the diameter of the lumen of the large intestine gradually keeps decreasing and reaching towards the rectum. And the purpose is to to form the stools, right, to solidify, because the stools have to be solidified and they have to be given a shape. So, that's why also the lumen keeps decreasing from proximal to distal. So, this one is the false. I mean, this is the false statement. Throughout the length of the intestine, number of, obviously, because as the stool becomes harder, that needs more of lubrication, so more of goblet cells towards the distal portion. Okay, so this is done. Then which statement lies, which structure lies deep to the left paraduodenal recess of peritoneum? This is a very super hit question, a common question rather, many times it has been asked. So the answer will be inferior mesenteric vein, correct? Okay. All can act as anti-gravity muscles except, okay. So the choices are sartorius, gluteus maximus, quadriceps femoris, gastrocnemius and soleus. Remember, anti-gravity means the muscles which help you elevate your body against the ground. So all these muscles here, they are actually extensors. This is extensor of ankle, extensor of knee, extensor of hip. Sartorius actually helps you bend down and sit down. So this is not an anti-gravity muscle. Skin on the back and lower surface of the heel is innervated by medial plantar nerve, lateral plantar nerve, medial calcaneal branch of the tibial nerve, lateral calcaneal branch of peroneal nerve. Answer is medial calcaneal branch of the tibial nerve. Question number 13. Nerve supply of short head of biceps femoris is, it's also an important question. Tibial part of sciatic nerve, tibial nerve, common peroneal part of sciatic nerve, common peroneal nerve. Remember, that is an exception in the back of thigh. It has a lot of importance. First of all, it is the only muscle that arises from the linea aspera, and it's an exception in the hamstrings, that it doesn't follow the rules of the hamstring, and it is innervated by the common peroneal part of the sciatic nerve. It's a got it? So this is the answer. The rest of the muscle, the back of thigh, they are all innervated by the tibial part of the sciatic nerve. Okay. In eliciting the plantar reflex, the area supplied by which spinal segment is stimulated? You know, this Babinski sign is the plantar reflex, which is checked by scratching the lateral border of the foot from the heel to the toes and then winding towards the greater toe, and that happens to check out this the segment, and that the dermatomal area is S1. Okay. Then which statement is wrong regarding the descent of ovary? The ovary descends from the lumbar region to the false pelvis. A gubernaculum is formed as in males. It extends from the ovary to the labium majus. The part of the gubernaculum between ovary and the uterus becomes the round ligament of the ovary. The part of the gubernaculum between uterus and the labium majus becomes the round ligament of uterus. So this is how exactly the same things was happening in the descent of testis also. And remember that one of the contents of the inguinal canal is the round ligament of uterus in females, right? And that is how, that was the course of gubernaculum in males also, right? So everything is fine here, except that it is very simple thing. Actually, it's for you to learn what happens with the gubernaculum in females, because that's why all the lower choices B, C and D are correct, and you have to find out the wrong choice. So they remember that this is the answer you had to select, because false pelvis में ovary नहीं होती. The ovary lies into the, descends into the true pelvis. Okay. This question was to learn the rest of the choices. Okay, question number 16. Which part of the female external genitalia develops from the genital swellings? Clitoris, labia majora, labia minora, both labia majora and minora. Which part develops from genital swellings? The answer will be only labia majora. Okay. Developmentally, uterus is ectodermal in origin, mesodermal origin, endodermal, mesodermal, ectodermal, or it is derived from all the three germ layers. What will be the answer? Remember, it develops from the paramesonephric duct or the Mullerian duct, and that complete structure, the uterus, develops from mesoderm. That is the answer. Okay. This is the answer. Mesodermal in origin. Okay. Then question number 18. Trabeculated part of the left ventricle is derived from conus, proximal dilated part of the bulbous cordis, primitive ventricle, proliferation of the atrioventricular cushions. Got it? So, the answer is primitive ventricles. Okay. Which lymphoid organ is incompletely encapsulated? A very important question, a good question rather. This I told you. There are the different, these are the 4 lymphoid organs which have been taught to you in histology. So, which of these is partly encapsulated or incompletely encapsulated? I told you the answer is tonsil, palatine tonsil. Only the portion projecting the oral cavity that's lined by stratified squamous epithelium, and otherwise deeper portion is not capsulated. Lastly, column of Burton is a feature of, it's a very common question and it's a feature of kidney. Okay, so it's done.